So, Stefan, are you ready to get started on the topic?
Yes. Hi everybody, I thought I'd start things off just telling you a personal story. So, for many years I do these goal setting retreats every year where I think about my year and what I did and what I didn't accomplish. And every year for the last decade, I've always had this problem, like getting up in the morning and feeling not well rested. And it got to the point where I reviewed this and I said, maybe I need to go to some sleep center or get instrumented and go through all this, like get really checked out by a doctor. And, frankly, I never did that because it just felt so invasive and so time consuming, and frankly the problem wasn't that bad. I just wasn't feeling all that good when I woke up in the morning. I can manage. And at that point I discovered the Lark, which is one of the companies that's here today. And the Lark is really designed to be more of a silent alarm clock, but for me what was important about it was not the waking function, but the monitoring function. And it basically, and you'll learn more about this, but it was awake all the time I was asleep and basically figured out how I was sleeping. And I always thought I had all these problems. Like I was thinking, well, maybe my wife keeps kicking me and I wake up and I just don't know it. Maybe that's why I'm not rested. Maybe I snore too much, I wake myself up all the time. I didn't really know, I had no data. And what the Lark taught me, and I'd wake up every morning, I'd get this little report that said, you slept this many hours, you woke up this many times, it took you 3 minutes to fall asleep. And just having that data and rating myself how I felt every morning, a little light bulb went on about 3-4 weeks of use where I said, Stefan, you gotta sleep at least 7.5 hours. And if you don't get 7.5 hours of sleep, you're gonna feel not well rested. And it sort of sounds obvious, and but you need to see the data to cause the change. And using the Lark, you get this little report card every morning, and even at night when you set it, it tells you, when you set it and you say you want to wake up, it tells you like, Stefan, you're going to wake up in 6 hours, and I'll wake you in 6 hours, and you already feel depressed at that point. You already know the Lark is really disappointed with you. So now my goal is to get to bed earlier, like to get to bed at 11:30, and I'd set the Lark and I'd say, Stefan, you're going to wake up in 8.5 hours, and we both feel so good. So that's my personal story about how one of these wearable devices really can change your life. And I really encourage you to try one device, any one of these that we're talking about today, or any of the other ones that are out there, just to experiment with it, collect some data, and see if just the process of collecting and interpreting that data actually can change some things that you're trying to work on. So today we'll talk a little bit about, I'll give you a quick introduction into the topic, and after that I'll introduce our panelists, and we've really assembled a great panel today. I'm very happy that you all decided to make some time tonight. Thank you very much. And you'll see some of the discussion topics here. Obviously, I think I've already given it away. I'm more on the more on the help side of things. I think these devices really do help. We'll talk a little bit about the hype too. I've prepared some tough questions for these panelists. So we'll talk about whether this really is just a big hype stream, or whether we're just on the cusp of having a whole new class of devices out there, sort of like the beginning of the smartphone. And now we're at the beginning of the augmented smartphone. We'll talk about how people are making money in this space. The cloud is very important. We'll talk a little bit about that. We'll see if we can get to manufacturing or not, depending on the time. We'll have a lot of questions on investment and some questions on privacy, and also how maybe some of these standards are different as we go out internationally. And of course, this being the German American Business Association, we're all very concerned with privacy, right? So that's why that question. And then we'll get to your questions. I'll make sure we have some time for that. So let me introduce the topic really quick. So what really is a wearable device? And it's the thing you wear on your jacket. And I'm actually wearing a couple devices here. I've got the Lark, and I've got the Fitbit as well. So that's helping me count my steps. I'm fully instrumented. And world premiere, I'm also wearing. You guys have seen it first in the entire world. I look at that as, that's the device itself. It's a small brain. Sometimes it's not even a brain. Sometimes it just pushes data and broadcasts it. You know, like the heart monitor that just broadcasts the heart rate. Generally what's involved in the middle is some sort of connected computer. And in the Fitbit's case, it's a laptop. In a lot of other cases, it's the smartphone. But the key here is that computer is connected to the internet. So that's how this data starts streaming out to the cloud. And there's already a bigger brain at work inside the smartphone, so it can give you some information about data. But then the genius really comes in when all that data is aggregated into the cloud, and enormously aggregated sometimes, where you start to compare yourself with other users. And that's really when you start to have really interesting things happen, where you may compete with people, where you might check on ROI decisions in terms of deploying these devices in a corporation, et cetera, et cetera. Also looking at how people are doing with their journeys as they're improving, and finding people that maybe are ahead in your journey already to encourage you. And why is this happening now? What's changed? And three things really: platform, technology, and economics. On the platform side, this is the first time we have these connected smartphones. You know, I think 5 years ago, maybe AT&T tried to sell you like the connected dog collar or something, but you had to buy like a data plan from AT&T to get your dog into the cloud. Like, who wants that? So now we all have smartphones in our pocket that are connected to the internet. So this is the first time these devices can access something that already has internet access. And cloud services have gotten all very cheap. I remember in my days at Broderbund, when I was a head of software there, we were really worried about getting consumers any kind of data from the consumer, because there's so many consumers. We just thought, you know, it'd be just expensive. But data today is just costs next to nothing. So the platform has been enabled. The second piece is the technology. One thing that's exciting is the power consumption for the chipsets that are on board and for the transmitters. Everything is going to very low power. So these devices last for 6 or 7 days. You know, it's not like they're just going to run for 5 hours. You want to wear them. You want them to continuously collect data. And this is now the first time that that's available with small batteries. So you don't need to wear a giant battery on your wrist. And then the economics. Hardware manufacturing has gotten a little easier. Probably isn't quite as easy as it should be, but that used to be, you know, the realm of large corporations that could command huge supply chain challenges. But today you've got 3-person startups that are building consumer-grade devices, which is really incredible when you think about it. Finally, there's a distribution. The distribution challenge has been met also. Consumers are sort of thinking now about getting their apps from the App Store, and basically you're able to sell directly to consumers in the specific niches. Just some information on market size. This is a big market. I think on the smartphone side, bottom line there is everyone's going to have a smartphone. I think we'll all have 3 smartphones, but by the time the researchers are done. We did some research into Apple itself, and I thought this was mind-boggling. Apple sold 100 million units worldwide in 2011 of iPhones, and 35 million of those were sold in the US. When you think about it, there's only 300 million people living in this country, so you know, 1 out of 9 Americans bought an iPhone just last year, just in 1 year. You know, I find that just incredible in terms of the ubiquitousness. And I guess it's the reason why the Apple stock is doing so well. Wearable devices, you can see the ABI research is also, this is in the fitness and health category. They say there's about 21 million units sold this year, last year, and that's going to grow by 40% over the next 6 years to 170 million units. So the market is big. These devices can be applied in a lot of different areas. I won't get into this too much right now. What's interesting is I think the ones that are succeeding are focusing first on the consumer and maybe not so much on the corporate side, although those are all areas of focus as well. And here's my hype slide or key challenge slide. You know, I think we still as an industry have a way to go to educate the consumer. I think the consumer doesn't yet know, just like they know there's an app for that, they don't quite know yet, hey, there's a device for that. Whatever problem you have, go out and see if you can buy a device that helps you with it. So a lot of education still needs to happen. I think a lot of companies focus on the hardware or the engineering. They focus less on the consumer and the ease of use. And when I did a search on the media, what the media feels about these devices, it's full of basically just hype in terms of just feeling really positive that there's something new. So no one's really critical at all, except for one columnist who said, well, what I really want is I don't want to wear a device. I want to have something to remember that I have to put on every day, right? You have to put on the Lark at night before you go to sleep, or you have to remember to put the Fitbit on. And that's difficult. It's even better if it were that's built right into the phone. And what makes it worse is if you then have problems, with Bluetooth pairing or other kinds of technology issues. So ease of use is really critical. I think another key challenge is that the iPhone has a perceived cost of $199. So people look at the devices that we're selling and they're maybe $149, $99, and people are saying, well, geez, that's half the price of an iPhone, and all I'm getting is a little sensor. But really, the true cost of the iPhone is what, something like $800 and up when you add up the data plan and things like that. But I think, in the consumer's mindset, they're thinking they're paying $199 for that smartphone. It's really tough to stay focused. That's related to opportunity management. I think there's so much opportunity in this space on the corporate side, on the medical side. It's difficult to pick the exact customer niche you want to go after. And of course, the last challenge is just getting hardware out. I think it does. I didn't believe it when I started, but I do now. That I think hardware just increases the complexity of the startup by a factor of 10. So, but hey, that also keeps the riffraff out of your so that's good. So those are my thoughts, and I now turn things over to our panelists, and we're really lucky to have these different companies represented because they're all in different stages of development. So first we have, and I'll have each panelist introduce themselves further, but first we have Woody Scal from Fitbit, all the way on the right, and his company's already has launched a Series C round, so they're well on their way. They're all over consumer markets and internationally in the retail space. So they were the farthest along. Then we have Julia Hugh here from Lark, who has been, her product's been out for about a year, and they just closed a successful Series A round. And then all the way at the beginning is Wanisha Prakash from Lumobac, and that's the company I'm with as well, so just for due disclosure. And Lumobac is still pre-product introduction. So we're coming out sometime this year, and the interesting part here is we're still seed funded as well. So 3 different time periods that these startups are in. And then we have Skip Fletchman here, who's a partner at Asset Management Ventures, one of the investors that's deep into this area. Quite cool. So why don't I turn things over to the panelists, and you guys can introduce your products and a little bit about yourself as well.
Here?
Yep.
Great. Thanks. It's fun to be here. Thank you all for coming. Again, I'm Woody Scale from Fitbit, and I was waiting for the 5-minute commercial, and Manisha was too, about after you did the LARP commercial, I thought there was going to be another 5-minute. No.
I can do that.
Look, I'll have to pick up the slack, sorry. So Fitbit, as you heard from Stefan, has been around for a number of years now, fairly well established now in the space of digital health and fitness. It's a really exciting category. There's a lot of innovation happening. There are a lot of people on the retailer side and on the corporate side waking up to this opportunity. And I think you hit pretty well on the trends that are behind it.
If you want me to show the video, just let me know.
I'll let you know. That's fine.
Okay.
So what Fitbit is about is Fitbit, our goal is to help people lead healthier, more active lives. It's that simple, it's that broad. And we do it by what we think are simple, innovative, friendly products that help people be more aware of what they do each day and stay more motivated to reach their fitness goals. So as Stefan kind of pointed to, our first product, this is the second generation of our first product, the Fitbit Ultra, is a wireless activity and sleep tracker. I'll tell you a bit about that in a second. Our second product, just launched in April, is a Wi-Fi scale. It's called the ARIA Wi-Fi scale. I think, why don't we start with the video, and we'll come back and I'll tell you a bit more about the products and the company.
Okay, let's see here. Focus.
There are so many things that tug at us each day. Job, family, kids. It becomes harder and harder to find time to exercise. Experts agree that shooting for 10,000 steps throughout the day or taking the stairs instead of the elevator can go a long way toward improving our health and our lives. Fitbit Ultra Wireless Tracker is here to help you turn everyday activities into better fitness and a healthier life. Tiny, discreet, and comfortable, Fitbit can go wherever you go. You can wear it on your waist, in your pocket, or on your bra. It's smarter and more accurate than a pedometer, with technology based on a 3D accelerometer just like a Wii controller. Your Fitbit tracker logs steps you take, plus distance traveled and calories burned, and its altimeter even tracks the stairs you climb. Because you see results in real time, Fitbit encourages you to make those small decisions throughout the day, like walking to the store or taking the stairs, that can add up to something big in your life. In fact, Fitbit users tell us that they walk 43% farther every day and lose an average of 13 pounds. Fitbit even works nights. Just slip your Fitbit tracker into the included wristband to track your sleep patterns, giving you valuable information that can help you turn restless nights into peaceful sleep. And whenever you get within 15 feet of your computer, the information is wirelessly uploaded to Fitbit.com, where you can see your progress with graphs and charts, track meals and weight, set activity goals, see calories taken in versus burned, and more. Online tools are free. There are no monthly subscription fees. Fitbit keeps you motivated with achievement badges and the ability to compete with friends and share your progress on Facebook or Twitter. For fitness updates on the go, use the Fitbit app on your iPhone to log your food and activities wherever you are. Lightweight, easy to use, and accurate, your Fitbit tracker is like having a friendly personal trainer that goes where you go, from walking to climbing to running to sleeping, helping turn every step you take into a step toward better fitness.
Nicely done.
So that's an overview of the Ultra, which is, again, the product that's really put us on the map. Got me. And why don't we turn to the slides and I can quickly take you through a little bit about
Just a few more minutes and then.
That's it. Okay, good. So Fitbit, again, is trying to help people stay healthier and more active. And we do it thinking about helping people be more active during the day, sleep better, and eat smarter. Keep going. I talked about the Ultra, which is this activity sleep monitor. Next product is this ARIA Wi-Fi smart scale. It's great because you just step on it, measures your weight, your body fat, calculates your BMI, and sends that information via your home Wi-Fi system to the Fitbit dashboard. And the next slide kind of points that out. Fitbit is really more than just products. It's actually, you can use them independently or as part of an ecosystem, using the app to track your food or your weight or other activities. It syncs with other apps as well. Then sends it to the cloud, where on the next slide you'll see we have a dashboard where you get a comprehensive view of your health and fitness, where you can see graphs, you can earn badges for motivation, you can compete with other people, you can have a social experience depending on what you want to do. So again, it's supposed to be empowering with information and then motivating with different features to really keep you tracking for your fitness goal. Next slide. This is how we see the company. And actually, it's one of the reasons I think this is such an interesting category. In the middle is the product. We try to make it the right product at the right price.
Excuse
But
me,
beyond that,
what is the price?
so I'm sorry, yeah, $99.95 for the tracker, $129.95 for the scale. But what makes it such an interesting category is because of the connected side, not only is it a product, but it's got the interactive tools around it, which are graphs, badges, competition and things like that. It's also got a social network that you can tap into, so for support and sharing information. So that, again, fitness is more motivating and fun when you do it with other people, and we try and empower that. With more than one product, we try and make it into an ecosystem. And then on top of all that, we try and add some services, fairly minor today, more developed in the future. But when you add all these things on top of each other, it makes for a very interesting business with multiple ways to monetize it, as well as some different, I think, layers of defensibility. So that's a bit about our business model. We'll go into it more in the future. We're going after a very broad market, the products that help people stay more fit every day, rather than just serious fitness enthusiasts. We're broadly distributed in a lot of the national chains that touch on consumer electronics, or even those that don't. And I think that's the last one. So hopefully the chime doesn't go off.
All right, thank you, Woody. Good introduction. Let's move on to Julia Hugh from Lark.
Great. Hi, everyone. It's great to be here. So I started Lark about almost 2 years now today, and came from a very different angle. It seemed like Fitbit had a real ecosystem in mind. For me, it was very simple. I moved in with my fiance, and every single morning he would wake me up with his horrible alarm clock, and I could not sleep, and it killed my day. And I just thought, I'm either going to kick him out or I'm going to do something about it. Because I suddenly realized without sleep I was a horrible person. And so I went over and we worked with Harvard sleep experts. And we worked with a woman who coaches NBA stars and Olympians on how to sleep better. And we created Lark. And I think maybe I will start with the video a little bit and then talk about the progression of what we've done so far. So this was what we launched with and how it's evolved. So.
All right, let's hope for the best.
stores. And we did a global exclusive with Apple, so we are now in every single store in the world that Apple is in, or that Apple has. And if you could go to the slides, great. So we really started with a mission, which is we understand that sleep is critical to people's health and happiness, and we help people sleep better. So the 3 ways that we help people sleep better is a completely silent alarm that wakes you refreshed, a sleep tracker and monitor, and a layer of sleep experts that look at your sleep patterns and then coach you through behavior change methods to improve your sleep based on your sleep patterns. So the first one is very simple. It solved my problem. It wakes you up refreshed, lets them sleep in. The next slide shows basically not only the sleep data, but we worked with sleep experts to help understand what does that mean, how healthy is that sleep compared to the healthy population, and how are you feeling in the morning, like Stefan so wonderfully said. The next slide. So we really believe that data is definitely the first part of the empowering people to improve. But the second step is really having expert coaching. So having experts kind of be at your side, understanding your personal data, and then telling you in very simple ways at the right times what decisions to make. And we've realized that every sleeper is very unique, and we've created these different sleep types. And once we understand your sleep patterns, we understand what type of sleeper you are and the easiest ways that you can improve personally. So if you move on, we do this in a series of programs. And it's a service, it's completely wirelessly coming to your phone. So this is real time, it's a Bluetooth sensor that sends directly to the phone. So it's very real time, kind of back and forth communication with our sleep coach. Next one. And next slide. At the end of 7 days, we can actually understand your sleep profile. And so we send you a 7-page report on why it is that you sleep the way you do and the easiest ways to improve. And so this has helped insomniacs, this has helped people who just have trouble sleeping, this has helped people with sleep apnea. Keep on going. And then we coach you through very simple ways, like basically small little push notifications on time to get more light, time to wind down for bed. Just small little things where you get a little trigger and then you are much more likely to do a decision. And that's about it.
All right, thank you, Julia. Okay, that brings us to Lummelbeck. Alicia.
Hello everyone, I'm Monisha Prakash, co-founder and CEO with Wearable. And we work on posture. And I always love how when I say that word, the room always straightens up. Everyone seems to grow by an inch or two. Yeah. So why posture? It's scientifically correlated with back pain. It's a $50 billion a year problem in this country. But even beyond that, there's research that correlates it with confidence, as well as core strength and general health. So it's a really important problem to go after. And we focused on that, and you'll learn a little bit about this from our video. A team of 3 co-founders, we came together and looked at dozens of ideas with the desire to pick an idea that we would launch into the company that we really believed in, and we thought it made a positive impact in the world. And it was through one of my co-founders' own experience with back pain and taking posture classes that really helped. That was really the light bulb for us to say, okay, well, how can we use today's emerging technologies to give people postural feedback and guidance the same way that these classes did for my co-founder, Andrew. And as you all know, the hard part about posture is constantly being aware. It's easy to get very, sucked into whatever you're doing or, wrapped up into it and to not know. And so that's the problem that we help address, is that postural awareness. It works through a couple of ways, through a strap that you put on your lower back that has a sensor, and that sensor will vibrate when you're slouching. That sensor also connects wirelessly to a fun app, which we'll show you as well. So maybe that would be a good time to roll the video, and I'll just comment that you can definitely tell, video quality is a function of how much money the company has raised. So I'll just leave it at that.
Hey everyone, please meet Lumo Back. It's a very thin, flexible, smart sensor that you wear on your lower back, and it vibrates when you slouch. But it's also an iPhone app that provides visual feedback on your posture. So when I slouch, Lumo slouches, and he also helps to guide me to standing up nice and straight. For most of my life, I've had bad posture, and my mom always used to say to straighten up. Nowadays, I sit a lot, and unfortunately not with the best posture. And that's led to back problems, and I've often felt less productive. But when I do sit in good posture, I feel a lot more energetic, and I feel that I'm able to convey a lot of my ideas a lot more confidently. The hard part is being mindful of your posture. So our team has spent the past year and a half trying to solve this problem. It started looking like this, and now we're really excited to show you this.
So let's talk about the sensor first. We've designed it to be slim, sleek, and so comfortable that you barely feel it when you have it on. When you're at your computer slouching, the sensor will vibrate to remind you to sit up. It's water resistant, uses the latest Bluetooth smart technology, and lasts 4 days on a single charge. The app is the other cool part. Lumo is your movement buddy. It tracks whether you're sitting, standing, walking, or running. It even tracks your sleeping positions.
We're very excited about where things are going with Lumo. We've already been in the news a few times and won some cool awards. What else can we do with Lumo? We're launching an SDK so that anyone can interface with Lumo and build the next generation of physical apps powered by human movement. We have exciting plans for bringing good posture and movement back into our daily lives, and we hope you'll join us. Thanks for listening. So as Stefan said, we're going to be launching later this year in the fall, and we'll be commercially available then. But I encourage everyone who's interested to go on our site and sign up, because we will be making a pretty exciting company announcement in the next couple of weeks, and you'll be the first to know.
All right, thank you, Manisha. That brings us to our last panelist, Skip Fleshman.
Hi, everyone. And thanks for inviting me, Stefan. It's fun to be out here tonight. I'm at Asset Management Ventures, a firm that's been around for 47 years now. And fortunately for you all, I have no video. I can't think of anything worse than saying we do about venture capital. But one of my friends did my partners had a Ustream venture capital thing set up on his desk, and you got maybe one follower. So anyway, historically we've invested in both healthcare and IT. Anywhere from therapeutics and biotech as Amgen, or medical devices, MDs on our staff. We've also invested in software and hardware. So we've had an interesting mix of skill sets that can go after both markets. We're an early stage firm, and investing traditionally in Silicon Valley. About 3 years ago, we were trying to be proactive for once, because we've been pretty opportunistic in the last 45 years, about what markets we thought would be interesting. We'd seen clean tech kind of come up and begin to fizzle a bit, and quite frankly, we were never too interested in it because we were a smaller investor, an early stage investor. But we were trying to be proactive and think about what would be interesting market going forward, and we kept coming across a lot of technology applied to healthcare markets in general. It could be diagnostics, it could be personalized medicine and genomics, e-billing, insurance. All these are areas that are very interesting to us, but the one that's popped up the most is the global health sector. And we view it a little bit more broadly than what we see on this panel tonight. Everybody else, these are relatively consumer-facing products, which we think are great. But we also go a little bit more towards the traditional medical devices as well. And an example would be Proteus Medical, which is a company we invested in quite some time ago, which has a smart pill technology, FDA approved, which will actually track a pill and make sure that it's actually consumed and complied with. So that's very much more on the healthcare traditional side. I think there are other opportunities on the traditional healthcare side as well. And that said, we look at the whole spectrum, anywhere from a company that may require FDA approval for home tracking and monitoring to more fitness or health or wellness applications. So we like all of those. And we're also looking at the platforms as well. So I think it's interesting what they're just trying to do with a platform. I think all of the hardware vendors are kind of thinking about how to do a platform. So that's
All right.
a very quick nutshell.
Thank you, Skip. So let's get right into the questions and let's answer, the whole reason we're here, whether it's hype or help. So I thought we'll cover that first, get it out of the way so I can relax. So, my first question is, I think a geek like me is obviously interested in these things. I buy one of everything. But for Woody and Julia, I was wondering, do you already have evidence that middle America, all those states we fly over, is actually interested in these devices, or is this just being bought in a couple of trendy stores, in Palo Alto?
Well, so about last June, late last June when we launched into Apple stores, we literally went from, little garage unit to going into Apple stores without having a middle ground of selling online. And the second day that we were live, I got an email from Middle America, an older woman, who emailed and said, "Oh, I just bought this Lark. What is Bluetooth?" And, and I was so excited because she was, clearly not an early adopter, but someone who told us that, she had sleep for a long time and had heard it on the doctors, and got into it. So my hope is that if you build something that really speaks to solving problems, and I think all of us have experienced the bad night's sleep, I think that it can transcend the chasm that we're all trying to skip over.
Yeah, no, I think I would agree with that last statement especially. What's I think interesting about this campaign is it really addresses issues that people have. It's your everyday issues. Like, how do I fit fitness into my busy life? How do I get better sleep? How do I make smart choices to eat better? So these are real issues, and technology and maybe some innovative businesses have come to the rescue of helping people do what they know they want to do, but have actually never been able to get themselves to do it and stick with it. So I think the answer to the question about, this is probably the first question I asked when I thought about doing Fitbit 2 years ago, and I quickly got through it by, one of the things I've learned over the years is when you see consumers adopting a product this quickly, sometimes you have to go back and put your own assumptions aside and try to figure out, it's solving a problem, now let's find out what problem it's solving. And I think actually that's been one of the reasons we've continued to grow, because we've really figured out what problem we're solving, what else. But, so the answer, I think, is, what tells us that this is entering the mainstream is certainly the rate of growth of our sales is extraordinary. The amount of publicity is extraordinary, and I think that can be hype, but at some point, if you're not really solving a consumer need, the word of mouth doesn't keep going, the consumer interest will die down, and it just hasn't. So there's that. There's the fact that mainstream retailers are really interested in products like these that solve real problems. So you saw some very familiar names out there, Fitbit, not just Amazon, but Best Buy, heavily investing in this category, a real smart pioneer in this category. Now AT&T will be Verizon in the fall, actually starting this month. Brookstone, Radio Shack, and these are not niche stores, these are mainstream stores. And then the final thing is just you look at some of the stats on Amazon, and in our category, in spite of the fact that we're a $99 device, we're actually number 1 and number 3 in the pedometer category. So you say, despite all those commodity cheap pedometers, Fitbit's actually number 1 and number 3 in the category. So a lot of evidence. I understand the question, but in some ways it's kind of the fly in the windshield for us. We're so far past that because we feel like we have it.
All right. Now, maybe Woody, I can just follow up. Has your user base actually shifted? Have you had them use the product differently? Maybe the early adopters used it in a certain way. Have you noticed any changes there?
Yeah, I'm sure. So the user base has changed. It certainly was an early adopter early on. But when we look at who's using Fitbit today, it's a very mainstream market. It's not 25-year-olds looking for cutting-edge products because they're cool. It's actually a very broad range of consumers, from people in their late 20s all the way through their late 50s. So the user base has broadened. The ways they use it has changed. But I think just in general, it's we just see continued evidence that it's really addressing the needs of a very broad audience. So it's just broadened. That's probably the whole thing.
Okay, now, I think all the selling points for all these devices are about how this is going to help you with something. So your behavior is going to change. So do you have evidence that behavior is actually changing as a result of the usage of your device?
Yeah, I think we've been gathering more and more data, and I think as we grow, we're getting some folks to really dig into the data some more. But what we found, two things. What we found really amazing is we measure user engagement and user stickiness, and we found that month after month, even since launch, people who bought it from launch haven't declined in using it. I mean, around 75% of our users use the product at least 3 nights a week. And so what that shows us is that it's creating continual value for them. We look at 7-day assessments. So we started out with Lark, and then we created a $159 price point Lark Pro, which helps people sleep better. And we monitor their sleep improvement through the 7-day assessments that they take week after week. And we have seen a very strong correlation. The more 7-day assessments that they take, the more their sleep improves. So it's really, as long as you stick with it, I think the benefits keep on coming.
Yeah, some quick stats from Fitbit. So user data told us that users take about 43% more steps when they use Fitbit from before they started using Fitbit. So and the percentage goes up more the less active you are. So we look at different segments of our user base and how active they are to begin with. So it's having a significant effect for actually all of our segments. And then we're also doing actually a clinical study with a major insurance company we started about a year ago. And it's a controlled study with a control group, Fitbit only, and then Fitbit with this insurer's coaching. And at the 6-month point of that, they showed almost the same increase in steps, depending on the group, between 30 and 40% increase in steps. So I think it is having a real impact, and stats are starting to show up.
And Stefan, I can chime in on that as well. Obviously, we don't have the longitudinal data of having been out there, but just from based on our users, our early users and testers, they report that their posture improves not only when they're using the device, but even when they're not. So what that tells us is it's accomplishing the goal, which is to create general postural awareness, whether or not you have the device on. And so we think that's part of it. We also know that another part of it is just muscle memory. When talking to physical therapists, as well as just looking at the research, if you sit like this for hours at a time, you're training your body and your muscles that's what's normal. The muscles in the front of your chest shorten, the muscles in the back elongate, and that's what you're training your body, and that equals muscle memory. Same thing, if you train your body through awareness to sit like this more often, you're going to create the muscle memory so that your body more naturally supports itself in sitting properly. That doesn't mean you master posture. I mean, you never have to work on it again. It's an ongoing lifelong process. But really, it's about creating more awareness and that muscle memory. And even our early data from our early testers is already showing that to be true.
All right, then maybe I have a question for Skip here. It's basically about metrics. So, when we make the rounds with the VCs, they're always asking about, well, show me some user engagement numbers, how many eyeballs are you getting on this thing and for how long? And I'm wondering, is this like just a leftover of, the social media internet movement where the VCs are always just looking at how much time are you spending on the site? Is that actually a valid metric in this category, or are there other metrics you look for to say, hey, I think this startup is help versus hype?
That's a good question. I think what it will come down to is what is the business model. If there is a company, it's almost a pyramid shape, right? If you sell your Facebook and you have 900 million users and you monetize it $1 a month per user, that's a pretty good model. If you need to be, and they're also engaged. If you sell an app, 99 cents, you sell 10 million of them, that's a great one-time model, but it's not a very good long-term business model. So typically we want to see some engagement that keeps people coming back. So as Julie has said, 75% use three times a week is a pretty phenomenal usage rate. So I think it just depends on the business model. If it's widely disseminated and sold, then you can have less usage, less engagement. But I also want to see something recurring, quite frankly. I mean, a one-off sale of a device is not particularly exciting for us. Lots of people coming back and some recurring business model. So that would lend itself towards more deep engagement. But it's just going to depend.
Well, that's a good point. Let's talk about the business model. And let's try to figure out where's this money coming from that we're all going to be making. Is it primarily the hardware sales? And I don't want to hear like you're going to look at all options are on the table and we're going to make money from everything. Where's really the bulk of the money coming from? Is it hardware? Is it subscriptions? Is it software? Is it, I don't know, maybe you're selling the data to somebody. Where is the revenue coming from?
I think it's probably no secret. Fitbit makes most of its money certainly from selling hardware. We have a premium service that we sell as well. But we actually see Fitbit as an ecosystem. So it's hopefully not just one product. It's other products you can add to the ecosystem to give you a more complete view of your health and fitness. Then some premium services you can buy on top of that. And then something tells me that technology in this category is going to continue to improve. So there might be new versions of products. And so hopefully those new versions will support additional sales as well. So that's what we.
Yeah, for us, it was quite exciting because we had spent about a year and a half working with sleep experts on understanding the different quirks of people sleeping. And a 45-year-old female insomniac and a 30-year-old erratic software programmer sleep in very different ways. And they both have problems struggling to sleep. And then you go online and you see all of these tips, and you know, it's like everything works when you're online. Everything is a solution, and so what we found is this expert-based coaching subscription program worked quite well. And so we launched this program. So you buy a $99 LARC, and you know, you buy it through the Apple Store, you buy it through Best Buy, you buy it online. You know, the margins for us are not great because what we're trying to do is provide a product at the right price point. I mean, you know, our product is very similar to a $5,000 sleep monitor that's FDA approved. But because we want it to be for everyone, it has to be $99. And so therefore the margin is not as great. But once we launched LARC Pro, which had a $60 margin for a 1-year personal sleep coaching service, it was quite popular. It was just called the official product of the National Sleep Foundation for helping people sleep better, the best product to help people sleep better. And what we found is that software subscription, you know, harkening back to the VC software craze, you know, it is fully margin, and we find is a very promising model, and so that's been you know, a large portion of our users buy it through our website, which also allows us to, you know, work directly with them instead of sharing the profits with the retailers. But we've also just launched an in-app purchase, and the $60 app purchase is quite expensive, but we're seeing the uptake every week. So that's, you know, that's where we think expert-based coaching services to improve parts of your life are quite positive.
I'll chime in with something. I think it's a fundamental question for this whole category, is what the business model will be. I sat on a panel a couple weeks ago where that was the number one topic of discussion was what is the business model? I mean, because if you think about it, consumers are fickle. They'll pay for something and they'll leave. They're not used to paying for health care. If you look at all the dollars that people individually pay for their health care in the United States, it's very low compared to what the payers pay. And so I know it's moving in the direction where we don't have to pay more because our deductibles or co-pays are all increasing. That's just the nature of the beast, but it's a very slow process. So most venture capitalists look at this market and are very nervous about the business model, quite frankly. I think you can go to direct-to-consumer so much, and the consumers back off. So if you think about it from those terms, it's pretty smart to start doing clinical study with an insurance company. It's pretty smart to keep your eye on what the payers and providers actually want and what they're doing, because you know, we're talking trillions and trillions of dollars running through that system as opposed to the consumer. The wellness category, a little bit different, because I certainly think, you know, weight loss is a category that has tremendous sales. Again, a fickle consumer. I try this, it doesn't work, I go on to this, I go on to that. So to stick with something for a very, very long time, it's a little more fickle. But that's, you know, the business model is the biggest issue we have. So I always advise companies that go to the consumer. It's kind of cool because you can circumvent the FDA, which is very, very painful. Make some early money, but continue to think about how you can monetize later by working with insurance companies. And companies like Body Media has done that pretty well. It's not like Fitbit's doing it well, or I'm sure will do it well. And Wearable and certainly has a very good angle there as well. So I think all these companies can look to directly to the consumer for initial monetization and then begin to think about working with it, especially with payers. Corporations, I'm pretty lukewarm on, quite frankly, but that's controversial. Some people have, I bet Fitbit has a couple of corporate deals, but probably not involved with their sales.
Alicia, you want to share your business plan with us?
You know, that'll be in the back room over there. That you have to pay for. We're monetizing that service.
It's actually a lot of what Skip said, you know, really focusing on the consumer now and getting our product out there, showing that you know, people want the product and they use it, that they're engaged. And then working along all those channels, you know, we've already started very serious discussions with multiple academic institutions, all of which reached out to us to do various types of clinical trials and research. And so we know that as we have those data and we can prove efficacy, that we could also use that to, you know, eventually have it reimbursed, medically reimbursed. So we definitely have our eye on that much bigger market. But as a starting point, we think it's smart to start with consumer first.
Let's talk about that consumer direction. I don't know if it's a fluke, but all three of the companies featured today are really focused on consumer first and are gradually starting to go into some of the other areas, as I mentioned before, like corporate wellness programs, corporation with health plans, and then of course there's the whole medical market. And I would imagine in the corporate side and the medical side, the margins would be much bigger. You could charge a lot more for these products. So why is it that everybody's targeting consumer first?
It's quicker, it's easier, consumers can make choices, more quickly with less information. And if you're really talking about consumer direct, why are we going consumer direct versus through a channel? Because we can make more margin. So it's a fast route to market. It's a great way to get things established. It's also a great way to get a brand established. And certainly we have done our share of corporate business and are actively pursuing that. And a remarkable number of them come through a CEO or some other decision maker in a corporation that says, I'm using my Fitbit tracker, why don't we get one of these for everybody? So it really, consumer seems to generate a lot of B2B interest. So it actually worked quite well.
Yeah, the sleep industry is quite interesting. So sleep clinics are sort of the dentists, but in the dinosaur age. It's unfortunate because you have a problem, with sleep. You don't quite know if you have a real disorder yet, but you have to go through months and months of waiting and live in a sleep clinic and pay $5,000 to them to live there 2 days to figure out if you have a sleep disorder. And so it's kind of flipped over. And so, going through the medical channel, if we were to, insert ourselves into the medical channel, we would be at the end of the funnel, where the sleep clinics are, instead of in the beginning of the funnel where, 100 million people in America have some sort of light sleep disorder to heavy sleep disorder, and to be able to help them early on before they have to go to a doctor. That's really what drove me to start this company. It's more exciting to talk with people that you can help right away, and so that's one of the reasons. And one thing that we found was once we developed our software more, and now we have a program that helps insomniacs really get through and improve their ability to sleep. Those programs are starting to be adopted, not in American healthcare channels right now yet, although we are working with sleep clinics now, so we are starting that. The first places that they were adopted were actually international doctors who didn't have as much regulation, who could sell this in their offices. And so we found that healthcare is quite exciting now that we have a tool that can aid sleep clinic doctors work with their insomnia patients and their sleep apnea patients as a medical journal.
And one of the things that Allison and Julia said, while this may not historically have been the case, I really think there is a trend where consumers are taking more responsibility for their own health care. And so I think they're much more interested than they ever were before. And being healthy is actually more than popping a pill. It's something that I do. My activity can actually affect my health outcomes. And hallelujah, there are actually some products that can do that. That's actually led to a lot of consumers deciding to invest their own money in these products, whether it be Lark or Fitbit or some others. So maybe not what we would have expected 5 years ago, but maybe that was the outcome of the healthcare debate, which was actually we can all do something by ourselves to improve our outcomes.
Yeah, that really resonates with us too, with what both of you said, is this notion that we can empower consumers to take control over their own health rather than relying on the healthcare system to do it for them. I know something that we really believe passionately about is helping people take those baby steps towards more, positive, healthy behaviors. And just those small baby steps can make a big difference in your overall health. So in the case of posture, you don't need to commit to, hours and hours at the gym and, to your already busy daily lives. It's simply when you're sitting, sit better, and maybe not sit as long, So when you have to take a phone call, take it standing up. Or, get up every 10 minutes, get up every hour, but just for 10 seconds. These aren't huge behavioral changes, but if you do them, if you take them, the outcome can be pretty dramatic. And so creating that sort of awareness and confidence that, gosh, just these little baby steps can help make a big difference is something we feel really passionate about, and that's why it makes sense to go to consumers first.
We'll do questions after in a little while. All right, let's switch over to the cloud and talk a little bit about all that data that goes up there. It seems to me if you wore a bunch of devices, the coolest thing would be if the data all got collected so that the Fitbit would tell me about how much I'm running, and then Lumelbeck at the same time could kind of figure out whether you're running in the right posture, and then Lark will tell me whether I have problems running today because I wasn't sleeping well. and is there such a offering coming? And is there someone we're all talking to that is creating this beautiful place in the cloud that aggregates the data? Or is every company going to basically build their own thing here?
Well, to start out, I don't have a great crystal ball here, but certainly each company is going to build their own dashboard of sorts and address the issues that they are set up to do. I think there are some natural players who might step in. Fitbit and other companies allow, through our APIs, we allow other devices to actually send their information to our dashboard. And so you can actually use Fitbit as a central place for your health and fitness information. There were some, there was Google Health and Microsoft Health Fall, and I'm not sure they're turning out, well, obviously Google Health or not, there's no more. But probably the natural player to do this would be a wellness company or an insurance company who wants to be more of an agnostic platform. And certainly every major insurance company, every major wellness company in America, and probably internationally, are looking at different ways that connected devices can actually play into what they're trying to do. So they could easily be one of the players. Could there be a third party that does it? I guess that's possible.
I think our attitude is just to focus on creating value for users, and part of that will be, participating in a platform, whether it's one that we create or one that we participate in. But ultimately, why does it matter, And so for us, can sleep correlate with posture, or can activity level correlate with posture or device? I think it's really starting from users and what do they need and what information and correlations do they need. And I think it really starts from there, and then the platform kind of builds based off of that, rather than starting with a platform that by itself, who cares? It's really about what value are you providing to the users.
Yeah, it's interesting. I'll riff off of that. It's sort of like the wave of electronic medical records, and I think that worked well because you wanted a repository of all of your information medically to be in one place. But the user doesn't really care. The user really doesn't, because they're not going to go in and interpret their health records. That was really meant for the third parties, the doctors, etc., and the insurance companies. And so in a way, I agree. I don't know if ultimately it's really the user that's going to drive like a need to see all of their data in one place. But a large insurance company, for example, does have an incentive to really draw all of these So, I would say that the characteristics of that platform are not as consumer-driven as the products that generate the data.
Quick question on the privacy side, so there's,
Yeah, just hold on one second. I have a completely different take on this.
okay, go ahead.
I actually think there will be a couple platform winners. We're looking for them, quite frankly. And it seems to me, just looking at the Fitbit presentation, that they wouldn't mind being it. I think they have a very nice UX. But think about it, if you wear a sleep device, you have a fitness tracker, maybe you're an athlete, and you want to do your athletic performance, measure your athletic performance, you have a blood pressure monitor, which is also web-enabled. You have all these devices, glucose monitor perhaps. Let's put it all in one place. That's a hell of a lot nicer solution, I think, to track everything and have it in one place, and then you can actually do trade-off analysis. The company Wellness FX, which does it pretty well. It's all based on your blood draw, but they are going after a very clinical path. I personally think that the device makers, maybe there could be one that really develops a platform that everybody uses, and I think what their sales are, but certainly moving down that path. But think about some of these other applications that are more wellness related, like my Fitness Pal. I think 20 million downloads. That's quite a few. So you have something like that, which has already established a pretty big user base, and then people want to plug in that we think is the scale. I think one of your competitors, but you're also one of your partners, is Fitbit looking at, is partnering with everybody, because they know that the endpoint is you want to measure your weight, you want to measure your blood pressure. That's of value. Now, how can you affect those things? Well, you have to have a Fitbit, or you have some motion, tool or something to help measure that. But then you can, work on improving your blood composition or your weight or whatever. So I think that there will be a platform or a whole platform that people like. And will the insurance companies develop it? No. Will the providers develop it? No. Do you ever try to go on a HAMP patient, health medical foundation? Epic sucks. I mean, it's bad. It's painful. So, I mean, you can't even send an email to your doctor. So I think they won't be the innovators, but I think they'll buy it. Platform companies.
I think so. The takeaway to any startup or any company is, where in that ecosystem do you sit? Is it based on providing value to users, based on more focused utilities and function, or is it based on being a platform play, or maybe both?
Yeah.
And it sounds like our approach is, look, let's focus on immediate user needs and think about the platform and how we plug into that ecosystem as we grow and as we get to understand our markets better.
There will be a lot of partnerships. I mean, you will all partner.
And we have a very open approach to that too. We believe that your data is your data. And so while we welcome people, other devices plug into our dashboard, we actually have APIs to send our information to other people's dashboards. We have partnerships with those apps that you talked about, as well as insurance platforms, wellness platforms, things like that. So we just believe that, frankly, we think platforms are a way to get the word out about our product. They're actually an awareness building vehicle for us, and more partnerships the better.
Well, let's talk about privacy. You hinted at it, Woody. I think in this internet world, with internet, all the activities we do on the internet, you have sort of a whole range. Like Facebook pretty much, I think, sells your data to anybody. Anything you do on Facebook is tracked. At least that's sort of my feeling whenever I'm out there. I worry about all the data. The other extreme, of course, is like if you ever try to get data out of a hospital or something, you got to sign like 5 HIPAA forms, and they still won't give it to you somehow because it's so secure. So as we're collecting all this data, are we going with the Facebook model, the HIPAA model, or somewhere in between? What sort of industry norm is emerging in this space?
I always think of the 2 words, aggregated and anonymized. So we really try to always, you are the holder of your data. So if you do want to get the insights, we'll transfer it back to you. But for us, can get better and better sleep types, and so that we can give you better information. And we have, as Woody Stefan mentioned, we take a look at how your sleep compares to Americans, other Americans, and so those all need more and more data, and so we aggregate and anonymize your data once it comes into our cloud, and then provide value back to you. We have not done any deals where we're selling data to anyone. We think that in the future, what might be a really nice, transparent model is, with your permission, sharing your sleep information directly with your doctors. And so far, what people have been doing is just printing out their reports and showing and talking to their doctors and giving them their online dashboard access. So it's very end user to third party.
So I pick up on one word, which was transparency. So on one hand, we certainly believe that your data is your data. We also believe that if you choose to, make some of your data more public, so shared with friends or family, or public if you wish, can actually make your fitness regimen more effective. So when we compete with friends, when we share our accomplishments, when we join public groups, that can actually help motivate some people, and a lot of people take advantage of that. So our approach really is to be very clear about very granular levels of information. So do you want to make your daily steps, do you want to keep it private? Do you want to share it with friends? Do you want to make it public? Do you want to share the calories you consume with one of those three groups? So we just try to make it very clear in the profile section, all this different information and where it goes. And we have certain defaults that are very visible. We just want to make it very transparent. I do agree that aggregated information can be helpful and useful in terms of developing norms, so we certainly do that. And then sharing information with providers, authorized by you, or with other platforms authorized by you, is definitely the main thing.
Okay, I'm going to switch focus to investment. Just a few more minutes, and we'll get to your questions. But I had a good investment question I wanted to ask, which is the splintering of each of the companies. Right now, we seem to have all these companies trying to build a consumer brand, for a specific focus area. So Lumo Back is focused on the back posture, Lark for sleep, Fitbit for fitness, various other consumer companies out there. Is it going to stay that way, or ultimately is it all going to consolidate into one large company? And what would be the characteristics of that consolidator? Are they going to be a successful consumer company like Apple doing the consolidation, or is it going to be one of us that somehow gets to the party first and gets most successful? How is that likely to play out over time? Or are we just all going to stay in our niches?
Am I on the hot seat for this one?
Look into your crystal ball.
Yeah, I don't see it. I don't see how anything can completely be consolidated because there have different levels of FDA requirements for some, and others are less so. And some are more fitness oriented, some are super hardcore fitness oriented, like anything Nike does. Some are more health and wellness, and they're just completely different. So I can't see much. I'll see some consolidation with success. But I can't see this whole category consolidated. It doesn't make much sense to me. I don't know what everybody else thinks. It's kind of crazy. Right now they're partnering. There will be some purchases, I'm sure, acquisition. I don't have a crystal ball on who will buy some of these companies. But,
Do you see a giant corporation that's already consumer focused, like a Google? I've seen some analysts saying, ultimately Google will own the space, or.
well, I mean, we're talking about consumer hardware products here, and I don't think it's a Google boy nightmare trying to do hardware. We'll see what they do with Motorola, but I think it would be more. I think most of the major players, like I'd say Samsung or Sony, they're probably watching this, if I can know they're watching the sector, and trying to figure out, is it gonna be something that's big enough to move the needle, because these are large corporations, before they jump in. I'm sure Apple's looking at it too, although they're, like to develop internal. Microsoft are all gonna look at this category and figure out, what's a winner. And is the market big enough? Right now, I don't think the market's big enough for any of these major players. But these are huge companies, so they need multi-billion-dollar markets, and we're not there yet. But it will be there, and I think those are, recent acquisition type of companies.
All right, I think it's time to give the floor to the audience and get you guys to ask some questions, maybe for another 10 minutes or so. And if we run out of questions in the audience, I have a few other good ones. We'll start in the front.
So Stefan, you have touched probably on my core question. Every morning I run, so I have an iPad, an iPod, and it tracks my route, GPS, a heart monitor, tracks my heart only. Don't have a pedometer because this thing already does it. But it's all kind of one-off, and you've touched on it, that why don't we have a sensor fusion which senses all of your bio information, distribute the sensors over the body, do what you want, but have one data acquisition system for the body, plug it into the iPhone, whatever you please, and some of all the information tells you much more about the body than just one instrument at a time. Each one of you are starved by your $99 price point. What if you had $500 or $300 price point? And because each one of you has an accelerometer, each one of you has an actuator, probably some piezo buzzer or something, or a piezo sensor, aggregate the information, and that tells you much more about the body than just one sensor at a time. And I'm just waiting for that device. And I don't think United Healthcare is going to be smart enough to do that.
So is there a question?
Yeah, so who's gonna, are you guys thinking about getting together, or maybe doing something where there is a sensor fusion which gives much more information than just one sensor at a time?
Yes.
Specifically.
I mean, the bet that we're taking is that the more we can correlate our data with other types of data, we're going to provide more value to users. And ultimately, that's where we're keeping our eyes, is how can we provide the most value to users? What do they need? And you gave a great use case. And so for us, the next phase of our company, we'll be looking at what are the partnerships that would enable us to do exactly the picture that you painted. I'm a runner too. I use Runkeeper, I use a heart rate monitor, and I use Lumovac. And the three things don't talk to each other. And I see a day where they will.
I think, I don't think it's an easy problem to solve for a couple of reasons. One, and there are companies going after this. Body Media is trying to do it. ASUS was trying to do it with their multi-sensor wristwatch. One happens to be suing the other for that very thing right now. But it's not a easily technical problem, I think. And when you layer in battery power, form factor, is it on your wrist, is it on your belt, is it in your shoe, is it a band? It's not a simple problem to have a form factor that works for everybody or that everybody's happy with, and have all the sensors in one spot. And I think we'll hone in on something like we honed in on a phone, a smartphone that is kind of cool now, right? But we had a lot of weird stuff before that. We're honing in on something that a lot of people have. We'll get there, but that's a few years away. And sensor technology, when you start mentioning scanner response and pulse and all these things that you can do, which are pretty cool, because right now we're basically 3 accelerometers and an actuator, as you said. But we'll get there. But it'll be a while. This is a tricky problem.
All right, next question in the middle here.
I totally agree, actually, the sensor factor, that's probably harder, but the data aggregation part, the technology is actually there. But I just don't see actually what will make the device companies be willing to give up the data. I mean, what would actually move someone for you? Right now, actually, taking away your kind of really cool apps, then devices can be commodity. So the data and your apps are actually going to be the one that's keeping your user there. On the other hand, the platform builders like Microsoft, HealthSpot, etc., they have the technology, but they have no data. So right now, actually, the thing actually for consumers and for healthcare providers, the data aggregation benefits is very, very real and tangible. But what would it actually take for everybody to be willing to play? Like right now, there are accountable care organizations where they want to create a kind of clinical health home actually for providers. If you're approached by accountable care organization saying, I want to make you part of my patient program, would you be willing to give up data, or would it?
So how important is the data to your business model, I think is the question.
So we give the data up today. We do that. We have open APIs that with certain partners under certain conditions, we allow a healthcare platform on the user's authorization to send their Fitbit data to that platform. And why do we do that?
Is HealthSpot one of them? Is HealthSpot one of them?
We actually do send it to HealthSpot. And we send it to Google Health, but we send it to insurance platforms too. And you can say, well, we should take a walled garden approach. We should we should force people to come here. And there's certainly a lot of logic there. There's other logic that says, number one, they can get a summary view and kind of an overview over there, but we have, it's now, challenges on us to make sure that we have more depth on our site and our apps and things like that. So it's a little bit of a challenge just to keep it engaging on our level. But like I said earlier, we also see those partnerships as a way to spread the word about Fitbit and about our devices and reach more people. So there are trade-offs. And so, again, we do it today.
Okay, another question.
Yeah.
Way in the back.
I actually, my name is Pedro Vacchi. I work for a neuroscience company. I understand, I actually could ask a question to each one of you, but I'll target Lark for now. But I understand sleep patterns a little bit. And one thing that's hard for me to correlate is arm movement, as your sensor is on your arm, with sleep patterns. So can you give me a little bit of a understanding on that?
Sure. So what we use is science called actigraphy. Actigraphy has been used in sleep clinics for the last 15 years. It's a gold standard of sleep monitoring, but it's actually wrist movements paired with very specific algorithms. So we measure 3,000 data points per minute. The wrist movement is actually extremely correlated to sleep efficacy. And Fitbit knows this. They've done it. We've just taken it to. I think we've just worked with sleep doctors on refining those algorithms. And there are studies. There are studies that have validated the PIM method as the most accurate method. Outside of strapping on a lot of things on your head, it is the most accurate method, and it is used consistently to diagnose a lot of different issues in the sleep.
So you can capture all the 5 stages, REM including?
So we actually, if you look at our information, we don't tell you the different stages of sleep. However, what's really quite interesting is that actually doesn't quite matter in the behavior changes that lead to improved sleep. In our method. So we're much more focused on cognitive behavioral therapy, which is what sleep therapists use to help people with insomnia.
Okay, thank you. There's no DO sensor like dissolved oxygen, like a...
No, there
Okay.
isn't. And, yeah.
All right, I'll take one more question. Let's see. Okay, we'll do these two and that's it. So one in the middle and then one in the back.
Yeah, my question was, I was just going to ask the same kind of question that he asked. I thought you were going to measure pulse rate and I was thinking that, for sudden infant death syndrome, would this be a good device for monitoring babies and giving a signal for a warning for SIDS?
Yeah, we have talked to doctors about that, but it's I don't wanna make any claims. That's just been early stage research. We've actually found that this has been used by the deaf and hard of hearing community, for example, and that it's because of our algorithms of waking people up that it wakes people up not only more refreshed, but it actually wakes deaf people up without desensitizing them. So as we launched the company in all of North America with 5 people, and so we were running like our chickens with our heads cut off. And so as we just focused on a very small demographic, couples with with different wake up times. As we are growing, we're seeing these different other opportunities, and in the future, we hope that we can address that market. But for now, not there yet.
All right, last question in the back.
Since it's the last question, I think it's quite appropriate as well. Just wondering, what happens after all these lovely devices have actually done their work and repatterned people to behave excellently with respect to all the various bodily functions that they need to perform? So where does the business model stand then in such a situation? Because typically, once you've kind of achieved your level of performance that you like to do, you don't really want to be dealing with that kind of stuff anymore, because you just do it naturally. Apart from the sentinel aspect of it, where does the business model stand then?
I have a Fitbit and I'm Lark, and I'm kind of addicted to both.
Addiction. Apart from addiction, but we'll cure that as well.
Well, from a Lumobag perspective, I think there's always additional areas that you can work on with the skeleton. So the back is the first interesting perspective, but you can think about the wrist and all kinds of different injuries that people have. I agree with you. If you get to the point where the user maintains, does the desired behavior, you'll probably move on and try to do other interesting things. But the world's a big place. A lot of opportunity there.
Yeah, and I don't think any of us see our offerings as being static. These are, for us, this is our entry point. But even with posture itself, you could think about the application of posture for so many other activities besides just general sitting and standing. We've had people who are really avid horseback riders, and posture is so important there, or yoga, running. I mean, there's so many, and good posture in any of those activities is different. So it's sort of staying ahead and listening to the market. So having that laser-like focus for today, and understanding, where it could go tomorrow.
Okay, so this conversation can continue for another 20 minutes or so. We may have a few drinks left.
We do, yeah.
Okay, good. You guys taking the time in your evening to educate us on this exciting category. Thanks again on behalf of GABA for participating.